Our next question, Dr. Leah. A woman asks, how can I protect myself against STIs from female partners, sexually transmitted infections?
Yep, an internal condom is a good way to protect you from STIs. They're actually inserted in your body. They were originally developed for use in the vagina, but the FDA now approved it for anal sex as well. Internal condoms can be inserted for up to 8 hours before having sex, and they have a thick rubber rings to kind of keep them in place. Those rings can also provide extra stimulation. A problem with internal condoms is that many people just don't know where to find them or even how to use them properly.
You know, I thought it was up to date on all types of protection. Are they hard to find or to use? Can you give us any tips, please?
You know, honestly, I've actually never seen them in a store before. They are expensive. You can buy them online. They are expensive. I mean, the last time I saw one was when I was teaching a sex ed course and just trying to teach people what it was. But the reality is there's 2 rings and you just kind of squeeze one ring and shove it up there, and then the other one kind of hangs out the side. So they really can be beneficial for additional protection because it's having more of a skin barrier. Dental dams are another way to protect yourself. These are thin sheets of latex or polyurethane that come in squares or rectangles. A person can hold them against their partner's genitals to block skin-to-skin contact during oral sex. Regular disposable gloves can also be used when a person is using their hand or fingers in or inside their partner.
What STDs can be transmitted between women, for example?
There are a number of STDs that can be transmitted between women. Herpes, genital warts, syphilis, and HPV are transmitted by skin-to-skin contact. Using dental dams or even plastic wrap can reduce the risk. Inserting your finger into a vagina can spread HPV, chlamydia, and gonorrhea. A disposable glove or finger cots can help protect against that exposure. Contact between the mouth, tongue, and anus really runs the risk of exposing you again to herpes, hepatitis, and gut infections. Genital-to-genital contact can spread herpes, HPV, and pubic lice. So you want to protect yourself by either wearing gloves or avoiding contact when any of these sores are present. And not thoroughly cleaning sex toys or sharing them can also expose you to chlamydia and gonorrhea. So you can use a condom over the sex toy or just don't share them.